For needle aspiration, you will complete a timeout and identify your patient and site prior to the procedure. Perform hand hygiene and gather supplies. You will need a 10 to 30 cc syringe, a 3-way stopcock, a 22 to 25 gauge angio with T-connector with a rubber tip, sterile towels, sterile gloves, chlorhexidine and or betadine, Vaseline gauze and 4x4 gauze, and a tegaderm dressing. You will connect your T-connector and stopcock with a syringe. Your provider will take the angio, clean the site, and insert the angio, then remove the needle. Once the needle is removed, your T-connector will connect to your angio and air is aspirated. Sterile technique is used during the procedure. Once completed, the equipment is removed. Cover the insertion site with Vaseline gauze and a small dressing after the procedure. For chest tube placement, you will gather your supplies. You will need the appropriate size chest tube, an 8 French, 10 French, or 12 French. 3 chest tubes are utilized in the NICU. We have the pigtail, the Turkel, or the trocar. All 3 types should be stocked in the supply room or the procedure carts. You will need the atrium chest drainage system. You will need a scalpel, chlorhexidine and or betadine, wall suction canister and suction tubing, sterile towels and sterile gloves, adhesive tape and safety pins, hemostats, Vaseline gauze, 4x4 gauze, tegaderm, and a suture kit. When placing a chest tube, you will first identify the patient and site prior to the procedure. Complete and document a timeout and provide pain management as needed. Perform hand hygiene and gather your supplies. You will need Vaseline gauze and hemostats that remain at the bedside for the duration of the chest tube. Place your patient supine, elevating the affected side. Secure the arm above the head and immobilize the patient during the procedure. Open atrium chest drainage system, maintaining sterility of the connectors. You will now perform hand hygiene and put on your sterile gloves. Now that you're sterile, remove the atrium chest system from the packaging. Turn the floor stand on the bottom so atrium is able to stand alone. On the back of your atrium, remove your pre-packaged 45 mils of water. The water and insert into the top of the atrium in the blue port. Fill the system with the water. Allow the water to flow into your water seal chamber to the 2 centimeter fill line. Once filled, the water becomes tinted blue for visibility of air leaks and monitoring of patient pressures. You will now connect the suction canister and suction tubing to the wall suction. Take the end of your suction tubing and your tubing connectors, also located on the back of your atrium. Select the appropriate size connector. Connect patient tubing connector to chest tube catheter after chest tube placement is confirmed by X-ray using sterile technique. Once chest tube is in place, connect into your chest tube, ensuring all connections are secure. The last thing to do is connect your suction to your atrium and turn your suction on. The suction is set at 80 millimeters per mercury. Your atrium system is set to -20 millimeters per mercury. If your provider orders a different setting, the dial is located on the side of your atrium. Once your suction is on, the expansion of the bellows across the suction monitor window will confirm that your suction is operating correctly. A separate suction setup is used for your chest drainage system and labeled appropriately. For optimal drainage results, the chest drainage system is positioned below the level of the patient's chest in an upright position. All connections should then be secured with tape. The chest tube tubing should also be secured to the bed with tape and safety pins to prevent accidental dislodgement.